Clinicals by Dr. Aisha Tabasumanatomy. Without the Yawns Clinic Ready, Coffee Friendly, and Cram Safe Rawalian 52. Clinicals of kidney. Palpation of kidney normally not palpable in healthy adults, especially the left. Palpable kidney may suggest hydronephrosis, renal mass, polycystic kidney, or ptosis. Tenderness infection, pyelonephritis, or trauma. Procedure patient lies supine. Bimanual technique, right kidney more palpable. One hand under the back at costovertebral angle. Other hand on the abdomen below costal margin. During inspiration, attempt to capture kidney. Paranephric abscess collection of pus between renal capsule and Gerota's fascia. Usually unilateral due to renal septum. Contract to pelvis, due to non-fused fascia. Nephroptosis kidney descends greater than 5 centimeters or 2 vertebral levels when upright. Suprarenal gland remains in place. Cause: loss of perirenal fat, for example, rapid weight loss. Symptoms: pain, standing/walking, hematuria, hydronephrosis. Treatment: nephropexy. Renal transplantation. Healthy donor kidney in iliac fossa. Renal artery/vein connected to external iliac vessels. Ureter to bladder, ureterocystostomy. Native kidneys usually left in place. Pain in pararenal region. Psoas major lies posteromedial to kidney. Pararenal inflammation irritates psoas. Hip extension pain. Renal nutcracker syndrome. Compression of left renal vein between aorta and SMA. Causes: narrow aorto-SMA angle, tumor. Pathophysiology: left renal vein pressure, retrograde flow. Symptoms: hematuria, flank pain, proteinuria, varicocele, fatigue. Management: renal vein bypass, SMA repositioning, stenting. Nephrolithiasis, kidney stones. Passageway of calculi. Kidney, renal, pelvis, ureter. Ureteric calculus stone blocks narrow ureter, 3 to 4 millimeters. Lodges at UPJ, pelvic brim, UVJ. Leads to hydronephrosis and colicky pain. Referred pain, ureter pain referred via T10L2: upper ureter, lumbar region. Middle ureter, lower abdomen, medial thigh. Lower ureter, external genitalia. Characteristics: colicky pain, nausea, vomiting, restlessness. Staghorn calculus, large stone filling pelvis plus chelicus. Cause: urease producing bacteria, alkaline urine, struvite stones. Treatment: surgical. Surgical treatments: ESWL, non-invasive, shock waves. C. Pregnancy, bleeding disorders. Ureteroscopy, endoscope plus laser. Best for mid/distal stones. PCNL, for large/staghorn stones. Small incision in back nephroscope. Surgical caution: 12th rib resection risk, pleura injury, pneumothorax. Renal angle: between 12th rib plus erector spinae. Tenderness infection. Ureter. Mobilization: segmental blood supply, renal, gonadal, iliac, vesical arteries. Anastomotic network in fascia/adventitia. Stripping fascia, ischemia/necrosis. Iatrogenic injuries. Oophorectomy, risk at ovarian vessels. Hysterectomy, risk near uterine artery, 2 cm above ischial spine. Suprarenal glands. Pheochromocytoma, tumor of adrenal medulla, chromaffin cells. Excess catecholamines. Features: paroxysmal HTN, headache, palpitations, sweating, anxiety, tremors, flushing. Diagnosis: plasma/urine metanephrines. Treatment: adrenalectomy. Adrenal disease, glucocorticoids, mineralocorticoids. Causes: autoimmune, TB, infection. Symptoms: weakness, low BP, anemia, renal failure, hyperpigmentation, hypoglycemia, salt craving. Treatment: Hormone replacement. Cushing syndrome, excess cortisol. Causes exogenous, steroids. Endogenous, Cushing's disease, adrenal tumor, ectopic act. Features: hirsutism, virilism, gynecomastia, HTN. Treatment: surgery, pituitary, transvenoidal, adrenalectomy, tumor removal. Urinary bladder. Cystocele and urethrocoele bladder/urethra collapse into anterior vaginal wall. Causes: childbirth, nerve/fascial damage. Complications: stress incontinence. Treatment: non-surgical, exercises, pessaries, drugs. Surgical: urethral sling, vaginal retethering. Trabeculated bladder, thickened detrusor from chronic outlet obstruction or retention. Less efficient bladder. Suprapubic cystostomy, extraperitoneal bladder access. Indications: urethral obstruction, neurogenic bladder, vesicle stones. Procedure: fill bladder, incise above pubis, catheterize. Bladder rupture. Causes: trauma, full bladder, surgery. Intraperitoneal, superior bladder tear, peritoneal cavity surgery. Extraperitoneal, anterolateral tear, paravesical space catheter. Cystoscopy. Endoscopic inspection of bladder/urethra. Indications: diagnostic, hematuria, recurrent UTI. Therapeutic, stone removal, biopsy, tumor resection. Urethra. Rupture, type, anterior, bulbar/penile, posterior, membranous, vertical bar, vertical bar, vertical bar. Cause: stratal injury, pelvic fracture, extravasation, superficial pouch, deep perineal pouch, seepage, scrotum, penis, ant. Abdomen, prostate, bladder. Note: no thigh entry, fascia, catheter. See till imaging. Hypospadias versus epispadias. Feature: hypospadias, epispadias, vertical bar, vertical bar, vertical bar, vertical bar. Location: ventral, dorsal. Cause: incomplete fold fusion, misplaced tubercle, TX, surgery, 6 to 18 Mo, more complex. Catheterization. Easier in females due to short, distensible urethra. Surgical caution: fold near meatus may catch catheter. Urethritis. More common in females due to short urethra and proximity to anus/vagina. Posterior abdominal wall. Psoas abscess. Cause: TB of lumbar vertebrae. Path: TB vertebrae, psoas thigh, femoral triangle. Signs: fever, back pain, thigh swelling, hip flexion pain. Iliaco-subfacial fossa may collect pus, mimics femoral hernia. Psoas sign. Stretch test: supine, extend hip, pain equals positive. Resisted flexion, side lying, flex hip versus resistance, pain equals positive. Aortic aneurysm. Localized aortic dilation. Causes: weak arterial wall. Pulsatile mass. Can mimic pancreatic/gastric tumors. Risk: rupture, high mortality. Treatment: EVAR, stent graft. Lumbar sympathectomy. Removes lumbar sympathetic chain, L2, L4, improves lower limb blood flow. Preserve L1 ganglion, important for ejaculation. Presacral neurectomy. Indication: chronic pelvic pain, dysmenorrhea, endometriosis. Remove superior hypogastric plexus, interrupts pain pathway. Caution: not for males, ejaculation loss.